Hi, everyone. Thank you for joining us for another episode of STEM Girls Virtual. My name is Emily, and I'm here on behalf of Cincinnati Museum Center. On this show, we talk about different careers in the STEM fields, those fields being science, technology, engineering, and math. Today, we have Dr. LaQuita Jones with us, who is an oncologist with Cincinnati Children's Hospital. Dr. Jones, thank you for joining us today.
Absolutely. Thank you so much for having me. I'm excited to be here.
Yeah, we love having you. And we also have one of our wonderful youth volunteers, Olivia, with us. Olivia, can you tell us a little bit about yourself? What grade are you in?
I'm an 11th grader at SCPA.
Awesome. Well, thanks for joining us. So, Dr. Jones, my first question is, what is oncology and what do oncologists do?
Sure. Oncology is the field of medicine that's related to cancer. So oncologists take care of patients with cancer. In the case of pediatric oncology, of course, we take care of children with cancer. And we actually take care of some adults as well, just depending on the cancer type. But for the most part, we take care of children. So that includes babies through, elementary school years, junior high school years, and then into their 20s. And then we also have some adult patients. But in general, oncology is related to the care of patients with cancer.
Okay. And it sounds like through your residency program that you chose pediatrics, and from there you chose oncology. Can you walk us through how you made those choices?
Sure. Well, so it's interesting because actually I wanted to be a pediatrician from a young age, actually. So I chose to go into pediatrics during college, and then the decision was solidified, during medical school. And then also during medical school, I developed an interest in oncology, particularly related to the fact that I was interested in understanding more about chemotherapies. So when we were learning about chemotherapy in medical school, that's when I decided that I may be interested in oncology. But when I did a rotation as a medical student, that's when I became particularly interested in the field. So I had to choose pediatrics before I actually went into residency. So I made that decision definitively when I was a medical student. And then later on during residency, through my rotations, I decided that I wanted to pursue oncology further.
Okay. And to follow up on this question, you had a fellowship and you studied something called novel therapeutics in childhood acute myeloid leukemia, or ALM. Can you explain what therapeutics are and what all that entails?
Yeah, so I study novel therapeutics in AML, which is acute myeloid leukemia. It's actually the most common leukemia in adults, but it's the second most common acute leukemia in children. When we talk about therapeutics, that basically means how do we treat the patients? So I'm interested in novel ways or different types of ways to treat cancer. We know that the cancer therapy that we utilize, which I'll talk about later on, but we know that the cancer therapy actually has a lot of different side effects, both in the short term, but then also long term. So the field has moved towards, actually for many years now, but it's really moving in that direction now, basically new ways to treat cancer in such a way that it's not affecting the patient or the person's sort of normal tissues, the normal parts of their body.
Okay, thank you.
Mhm.
And so can you tell us what are ways that cancers are generally treated? You
Sure.
touched on chemotherapy a little bit, but
Absolutely. Sure. Yeah. So in general, cancers are treated with largely chemotherapy. That's sort of a historical situation where we started, not we, I actually haven't been in the field for that long, but cancer has been treated with chemotherapy for many, many years. So that's sort of the historical standard. In addition to that, some types of cancers, particularly solid tumors, like, you may hear in adults like breast cancer, I won't mention any other types of cancer, but just various types of cancers that are more solid tumors tend to be treated with things like radiation therapy. In addition, nowadays we have more agents that can be utilized, which are medications that can be utilized to target specific things in the cancer cell. So for example, if a cancer cell, let's say, has an abnormal protein that it expresses, we can target some of those with certain types of medications. And those are more targeted therapies. So in addition to chemotherapy, in addition to radiation therapy, some cancers are also treated with targeted agents, which is what I'm actually particularly interested in.
got you. Can we take a moment and maybe talk more about what is chemotherapy, what is radiation therapy for some of our younger viewers?
Yeah, sure. So chemotherapy is basically a form of a medication, more or less, that helps to get rid of cancer cells. I won't go into the details related to how those chemotherapies work because they differ based on the class of medications, but usually those are medications that are either given by mouth, or sometimes a lot of the time they're actually given by IV. So our patients have to have IVs placed of some form to get medication. In addition to that, radiation therapy is what I also refer to in terms of treating our cancer patients. And the radiation therapy, I also won't go into the specifics related to how that works, but nevertheless, it involves going to a center where patients actually go through a machine where they get radiation therapy that's targeted to a specific portion of the body to help treat the cancer, to get rid of the cancer cells.
Okay. Okay. Yes. Thank you for breaking that down. And are there different ways to treat children versus adults with cancers?
Sure, sure. So in general, the ways that we treat children versus adults is very similar, but in terms of when we select a specific treatment for an adult versus a child, that's where it differs. So for example, in adults, as you could imagine, a lot of adults, or I shouldn't say a lot, but many adults may have underlying medical conditions. Let's say, for example, if an adult has high blood pressure or has like heart failure or something like some underlying kidney issue or lung issue, that would sort of preclude them from getting some of our more intense chemotherapies. But that's not usually true for children. Generally speaking, children, we can give them more intensive chemotherapy depending on the situation. But in general, we certainly use chemotherapy both in the adult and the pediatric population. In addition to that, radiation therapy is utilized in both situations, and then also targeted therapies are utilized in both situations. I will say that a lot of the drug development that happens actually usually begins with adults, just because that's sort of the way that drugs have been studied over time. But in general, we treat them similarly, but it's different in terms of selecting agents, and then also the way that we administer the chemotherapy is different in terms of like the sequence of medication and that sort of thing.
Okay. And in fact, Cincinnati Children's Hospital, where you work, is ranked third in the country for their pediatric cancer program, which is a really amazing resource that Cincinnati and the tri-state area have. Can you talk more about the work that the pediatric cancer program is doing?
Sure, I will do my best. The pediatric cancer program is actually huge. There's a lot of work that's been done over the years, and certainly most of that work precedes my time here. You know, I've only been here since 2015, and I joined the faculty in 2018, so I haven't been here for that long. But nevertheless, some of the current things that are happening in the pediatric cancer program include something that I'm a part of, which is our sort of bench to bedside research programs that we're building. So I'm working on building a laboratory. So I'm a physician scientist. So I take care of patients and I do research. But importantly, you know, as it relates to our research, we certainly want to do research that's going to help our patients. So the goal is to get the research from the bench or from the lab into the clinic. So we're doing a lot of efforts in the area of bench to bedside research. In addition to that, because I mentioned already that chemotherapy is actually, unfortunately, it's pretty toxic. Actually, it can be toxic in the short term and long term. So we have also, when I say we, I mean as a field, not just Cincinnati Children's, but as a field, we have focused a bit more on immunotherapy as well, which is basically utilizing the body's immune system to help target cancer cells, excuse me. So it's actually a form of cancer therapy where the body helps to get rid of the cancer. So there is a growing immuno-oncology program at Cincinnati Children's as well. In addition, there are different forms of radiation therapy that are being developed and being expanded at Cincinnati Children's. In addition to so many different things, honestly, related to, there's a unique sort of patient population that we take care of in pediatric oncology, the adolescent and young adult population, which is by definition, that's 15 to 39-year-olds. And that's sort of a unique population that requires sometimes, you know, a different set of care. But we have a growing adolescent and young adult program. We also have a growing survivorship program. You know, so when patients are treated with cancer and they get into remission after a certain number of years, they actually transition to the survivorship clinic where they continue to be monitored throughout their lifetime. But the survivorship program is also growing. So there are many, many things, honestly, and that's, I'm sort of just touching on the surface in terms of the growth of this cancer program at Cincinnati Children's.
No, but it's a wonderful program that our city has. So that's great. Can we take a moment to talk about the resiliency of your patients? I think when people hear pediatric oncology, it's probably very hard to talk about, but you probably work with some really amazing kids and their families too.
Absolutely. Yes. They're the reason why I do what I do.
Yeah.
And that's the reason why I went into this field, which maybe we'll talk about later on. But absolutely, the biggest draw to me with regard to going into pediatric oncology was during my medical school rotation, I realized how much the kids were very resilient. So they could literally be in their room getting chemotherapy in the morning, in the afternoon. Obviously, this was before COVID, but in the afternoon, roaming the hallways and playing video games, just happy as can be, despite the fact that they were going through cancer therapy. And that really impressed me. And I would say that that has continued to hold true throughout my time in practice, during fellowship and also post fellowship. I've really been able to observe how amazing the kids are, and the kids and their families. It's not, it's the kids certainly because they're going through it, but it's also their families that are really amazing. I could only imagine what it's like to go through that firsthand. And we certainly walk through it with them, but it's not the same as going through it. But they really have the ability to bounce back, to be positive, to focus on good things that are happening. And certainly they have, times that are rough, but they really bounce back and continue to press on despite many, many difficulties. And I think there's a lot to be said about that.
Yeah, very true. Thank you. And you briefly mentioned COVID, but can you walk us through maybe what a typical workday is like for you, understanding that COVID has affected that?
Sure. Yeah, that's kind of evolved over time. So I
Yeah,
guess my current workday, I can tell you what that looks like.
sure.
So I do mostly spend my time in the lab. So I'm working on building a research program at Cincinnati Children's related to AML, or acute myeloid leukemia. So I spend most of my time in the lab planning experiments, executing experiments, overseeing experiments. I also spend my time writing grants and writing papers. That's something that's important that you have to sort of embrace. And it's important, honestly, for the field. But as a scientist, that's one of my main roles. In addition to that, I do have clinical duty. So there are weeks when I'm working on the inpatient service, taking care of patients. Which is that my responsibilities are purely inpatient, but there are many of my colleagues who also have outpatient duties where they see patients in clinic. And then we do sometimes also do procedures, because in order to diagnose our patients with whatever the underlying disease is, we usually have to do procedures, often have to do procedures to figure out what's going on. So sometimes that's part of my day as well. And then of course, meetings and meetings and meetings.
Yes, meetings never go away. They've only grown during a pandemic, probably. Awesome. And so one other question, I'm going to switch gears a little bit. We talked a little bit about this offline, but can we talk about representation in STEM and how it doesn't just matter in STEM, but in the medical field in particular? Can you touch on that?
Absolutely. Yeah, representation matters on so many different levels. Like you said, not just in STEM, but also in medicine. And, as it relates to medicine, I'll speak to that a bit. It's important that we have physicians that look like the patients that we take care of. So obviously our patients come from a variety of backgrounds. The demographics are diverse, right? So we need to have a diverse workforce as well. And that has shown to be a factor in many publications. There are many publications that show that basically when patients look like their physicians, they actually do better. So that is a reason why representation is so important. We do know that, and actually I'm working on some health disparities work as well, which I have not talked about today, but we know that there are health disparities that exist. And for that reason, we would like to increase representation. And that's something that we're actively working on at Cincinnati Children's. It's actually a really big initiative that's being taken on throughout the institution. But we know that when the workforce represents what the patient population looks like, our patients do better, both short and long term. In addition, it helps to build trust, right? Because if someone looks like you, then certainly you are more likely to trust them. So I could say a lot about that, but I would just say that in general, it impacts how patients do short and long term.
Yeah, and I love to hear that there's a program going on at Children's to talk about different things like that. That's fantastic. So can you, again, I can imagine your career can be very challenging and rewarding, but can you just talk about that a little bit? We've touched on it a bit, but just maybe some of the challenges you face. Those can include COVID or not.
Sure. Yeah, that's a challenging question to answer. So, I mean, in general, of course, it can be difficult. And I think when people hear, like you mentioned earlier, pediatric oncology, some people, I think their guards kind of go up. And I've even been asked, how do you do that? And I say, well, of course, it's rewarding in a way, and I want to help people. So I went into the field to make a difference. So yes, it can be difficult at times, and it can be taxing emotionally, physically, and otherwise. But ultimately, I'm doing this to help people. And I want to see that, children don't have to deal with cancer anymore. That's ultimately the goal. So what are the challenges that I face? I would say it depends on if we're talking about my clinical load versus as a scientist. So clinically speaking, certainly there We have to deal with difficult patient outcomes, right? Not every patient survives, unfortunately. So that can be really difficult because this is a child that we're talking about, and this is a person. So even if it wasn't a child, it's a person that matters, right? So that can be really difficult. We certainly grow and develop a really strong connection with the patients and their families. So that can be challenging. So we walk through this process with them. So the whole grieving process can be challenging at times. In addition to the workload, I mean, it's certainly a busy organization. It's a very demanding career, particularly on the clinical side, but also on the science side as well. So as a scientist, I would say that the challenges that I face have to do with, continually having to, apply for grants and that kind of thing, because there's some pressure that comes with that. But, thankfully, I have a great support system with my mentors and with the leadership at the hospital, and they're really helping me to get through this because I'm still in my early stage of my career. So thankfully, they're really supportive and they understand that it takes a lot of work and it takes time to build to build a strong foundation as a scientist, because I'm still, I would say, pretty new to the area of science.
Okay, thank you for touching on that. And I want to ask this separately from a following question, but if there is a family listening right now and they have concerns about what we're talking about, where could a family or a person go to learn more about the pediatric cancer program at Cincinnati Children's Hospital?
Sure. Yeah. So if you go to Cincinnati Children's website, cincinnatichildren's.org, you can actually just search for the Cancer and Blood Diseases Institute.
Okay.
This Cancer and Blood Diseases Institute, or CBDI, actually encompasses the division of oncology, the division of hematology, and also the division of bone marrow transplant. So if people want to learn more about the cancer program, you would just search for Cancer and Blood Diseases Institute on the Cincinnati Children's website.
Okay, and we'll share a link directly to that page in the event description. Thank you. And if anyone would like to learn more about oncology or pediatrics or becoming a doctor, can you share some resources with us that we'll share in the event description?
Sure. Yeah. So if people want to learn more about pediatric oncology in particular, I think a really good resource is actually the Children's Oncology Group website. So COG, that's a really good website just to learn more about, some of the therapies that are out there. There are actually resources that are specifically tailored towards families on that website, patients and families. In addition, the Cincinnati Children's Cancer and Blood Diseases website actually has some information that would be beneficial to people who want to learn about the field.
Okay, thank you. Do you have any
So
questions?
one of the questions I was wondering is, what is your favorite thing about your job?
My favorite thing about my job, actually, my favorite thing about my job is the patients and families. So the patients are wonderful and their families are as well. Like I said, they go through some difficult times, but just to see how they're able to navigate that, I think that's really incredible. And I'm really thankful to have an opportunity to work with them. So I would say the patients and their families.
Yeah, and we already touched upon this, but what made you want to become a doctor?
Okay, yeah, that's a good question, actually. So it's interesting because, first of all, I'm the first person in my family to go to college. So I actually knew from a pretty young age. I remember being asked in, I think maybe, let's say, first grade or second grade, what I wanted to do when I grew up. And one of the things that I listed was becoming a doctor. So I knew pretty early on that I wanted to be a doctor. So what made me want to do it? I think if something was just in me, I just really had that drive to want to do it. But over time, I realized that I really enjoyed science and I really enjoyed math, both of which you have to study when you pursue pre-med in college. So those things, in addition to the fact that I really wanted to help people, I know that that sounds really cliche. And a lot of people say that when they go into medical school, but it was true. I really wanted to help them in that way. I wanted to help to make sure they were healthy. I wanted to take care of kids because I loved kids. So all of those things contributed to me wanting to become a doctor.
Okay, I was just wondering, do you have any advice you would give to young women or girls who would want to have a career in STEM?
Absolutely. Yes. I would say, go for it. That's above all, that's my advice. I think it can be a bit intimidating, right? Because, to be honest with you, there certainly needs to be even more representation as it relates to being women in STEM fields, not to mention women of color, but women in general certainly need to be more present in STEM fields. So I would say go for it. Don't let the sort of makeup of the field stop you from moving forward. Don't let the challenges stop you from moving forward. I would just say, just go for it. I think you kind of have to find people that are willing to support you, who are going to encourage you throughout the process. You need to have a good support system, but in addition to that, don't get distracted by things that are discouraging as you go along the way. But I would definitely strongly encourage people to go for it and to build a strong support system as they go throughout the process of pursuing that profession.
Awesome. Thank you. And that wraps up our interview with Dr. Jones. So again, Dr. Jones, thank you for joining us today.
You're welcome. Absolutely.
Yeah.
Thank you so much for having me. I'm excited to be here.
Yeah, and Olivia, thank you for joining us. We'll see you next time.